I tell you the funny thing, as a surgeon, we used to sit around in the surgeon lounge and we used to kind of compare notes on cases, interesting medical problems, what's the stock market, tell jokes, you know. Now what we do is we talk about which metal should we buy? Should we put our pension plan into gold? Should we bury our guns in the backyard? And where are we going to go? That's really what we talk about. And what the problem is, then the third question is, there's no place to go. Now, there are these offshore plans for different hospitals. We were just talking about apparently one's going into Barbados, maybe that's going to be a cash hospital. That'd be great. AEPS actually looked at Antigua. We were going to partner with Amway, and we were going to build a cash hospital, very cost effective in Antigua. But the problem is we were afraid that Hugo Chavez would threaten us. So it was too risky of having it all taken over by him. So we didn't do it. But that's maybe one of the possibilities. But I know my friends, here's one of the things. We used to have a brain drain. So the smart guys from India and the smart guys from different places overseas would come here and train and they'd stay. Now they're coming here and training and they're going back home. So, but those of us that are Americans, I mean, I'm trying to figure out, you know, is there anything I can do in Canada, you know? I'm actually just going to go into chickens and forget the whole thing.
You know, I think a lot of doctors will retire if they're getting close to that age. You know, if they're getting to that point, they might just retire, or you know, if they're young enough to retrain as veterinarians or dentists, they might do that. Okay, they might not physically leave the country, although a lot of them would like to. I get asked a lot of times, how can I, by doctors, how can I immigrate to Canada or Australia? Those are the two most common countries that I'm hearing. Canada because of its proximity. Now, you can go to Canada and pay a doctor cash for care. You can, as an American. Okay? It's just Canadian residents that can. Okay? So everybody in this room could go to Canada and pay a doctor for medical care. It's just Canadians that can. So it might come to the point where, I mean, we're already bringing Canadians to the U.S. for care, that we might start shipping Americans to Canada for care.
That's terrible, really, when you think about it.
So the prohibition in Canada is from a Canadian doctor taking money from a Canadian resident for care. It's just like it is down here in Medicare. If you're covered by Medicare and your doctor's enrolled in Medicare, you can't pay that doctor cash. It's the exact same rule. Okay? So we might be getting care out of the country.
It's not just about suing doctors, it's really about at every level of manufacturing. So that you've got, but honestly, I think maybe the regulatory environment has become more expensive than the lawsuit environment, from what I can see. I don't know the exact numbers, but the regulatory environment, it costs so much to get through the hurdles. I think that's the big thing. But here's the problem with tort reform. And I like tort reform at the state level. I do not want to keep hearing my federal officials talk about tort reforms, because as much as I think it'd be great, it's not in the Constitution. I'm sorry. You can't limit what a lawyer's going to charge, and you can't tell him how to do his business. That's not a constitutional issue. If your state wants to do it, it can make some sense. In Mississippi years ago, they lost all their OBGYN doctors because they were paying so much in malpractice insurance because they were always getting sued. And what they did was they said they capped non-economic damages. And suddenly, you know, these lawyers that first made the case, they always complained that these poor patients, you know, they deserve the best. But as soon as there was no money, those poor patients didn't get any pro bono work. And the lawsuits went away and they could get businesses back in Mississippi. So tort reform does work, but you have to bring the numbers down to where lawyers don't want to have to go after you. One of the things, an easy way to do that is not mandate that people take malpractice insurance. That does it without having any tort reform.
Privacy issues under Obamacare.
There is no privacy under Obamacare.
Yeah, I mean, really, he covered it a little bit, but
yeah, I mean, you know, if I tell my husband or if I tell Ralph about a patient I saw in clinic today, and it gets out, and I could be charged with a $50,000 fine per occurrence, and I don't know if I can go to jail for it, but it's a big deal. I think I can. It's a big deal, but I am mandated, when you come in my office, and I'm not a primary care doctor, so it's different for those guys, but it's coming down the pike, when I'm mandated to give the government your body mass index. You know, I am to, whether you do, do you have any psychiatric problems, you know, do you have guns in the home? I have to tell the government a whole bunch of stuff about you. There's no privacy. I'm mandated to give it to your workman's comp, and every government agency that wants it. And you know, they keep losing it. Have you noticed how they can't hold on to a computer? My husband's a retired Marine. I was in TRICARE, and they lost 3 million people's information in one of their computers. They keep getting these computers stolen. Some of it is to to mine information for economic purposes. So it's dangerous. And we never used to have this problem. My dad used to have all his records were in one little filing cabinet, and you had one line, and nobody ever had their privacy, lost. It was just stupid. But now it's privacy only to the people that you might really want to have the data, and other doctors. It's horrendous for me to try and get information from another doctor about you. Don't be unconscious because I can't do it. I have to have your help.
Right.
It's terrible.
Let me just add to that. One of the things you should never, ever do is sign a HIPAA form when you go to see a doctor. Okay? You're not required to.
They can't deny treatment.
Correct. They are required to offer it to you and ask you to sign it, but you're not obligated to sign it. You don't have to. It simply makes it easier for them to share information. Okay? Now, over the last 8 years since I left Canada, I've had a plan with an $8,000 deductible. My wife's had 2 surgeries. I've never, ever made an insurance claim. When I go to the doctor, I don't tell them my correct date of birth. I change it a little bit every time. I don't give them my government tracking number.
Yes, paranoia is a way of life.
I'm sorry. When I say government tracking number, they call it Social Security number, but I call it a government tracking number. I don't give my government tracking number. I don't give my driver's license number. You can confidentially speak to your priest, your rabbi, your lawyer, but your doctor's required to share that information. And a doctor that has signed a third-party payer contract, if you've ever looked at those third-party payer contracts, and you have to sign them before you can read them, okay? But they basically say that the physician can be asked to share medical information with the payer, okay? So I just never give it. Now, if I were getting a prescription for a controlled substance, I would probably be required to, but I haven't taken antibiotics since '77. I haven't had a prescription since then either, so.
Well, and there are some ways around it. The one way you can absolutely ensure your privacy is go to a cash doctor.
Yes.
See, a lot of the doctors in AAPS, the reason they're cash doctors, it's not about the money. It is somewhat. I mean, they want to be direct to the patient. But it's also because they didn't feel that they could be Hippocratic oath doctors under the system because they were required to share information. And privacy is what allows you to be honest when you come see me as a physician. So they got out of it, and so when you give them their information, it goes to paper, it goes to the file cabinet, and nobody else gets it. That's one way. The other way is, if you have, let's say you, and even if you have other drugs that you've used through your insurance company, when you go through your insurance company to buy it, to get a drug out of the drugstore, you are now in this huge database. They know exactly what you're taking. I mean, I can go to Mississippi, get on the computer, pull up your name, and know exactly what you're taking. I can. Now, here's the thing. If you just pay cash for it, then I can't. So if you really want to be private, if you're taking a med you don't want anybody to know about, there's a thing like mild adrenal insufficiency, and it's not very well recognized by the standard medical community, but it exists nonetheless. So those of us who take a little dose of Cortef in the morning just pay cash for it, so that we don't get denied insurance. But that, you can do that, and you actually find out that your cash pay for the whole drug is less than the copay if you've gone through insurance sometimes. So that's how you maintain privacy. You go to a cash pay good doctor that doesn't take any Medicare, and a lot of family practice, like we have guys it's interesting in APS. So we have, if anybody's watched what's that show? Royal Pains, okay? Hank Med, he's the concierge doctor to the wealthy. Okay, we've got some of those people that they take cash, big money from the wealthy, but we also have cash doctors that treat the poor, and they treat the poor and make a living less than Medicare rates, less than Medicaid rates.